We understand that these times remain challenging. CMI continues its mission to make it convenient for you to get premier outpatient care while deliberately making CMI the safe clinic for you and all those who are dear to you. Premier outpatient care is now available in the tip of your hands. With the same unhurried, meticulous attention, you can consult with CMI's broad range of specialists by phone, by video, or in person. For patients who prefer to see their doctor in the clinic, virtual patient screening for symptoms is mandatory prior confirmation of your appointment. We send online health declaration forms for you to fill out. Once your appointment is confirmed, you are all set to go to CMI. Since companions are not encouraged, patients are dropped off at the main entrance of Ori Central, where CMI is located. Kindly keep your mask on at all times. We want you to be safe in our clinic, right from the doorstep. Here are the clinic protocols we have implemented for your protection. Upon entering, your temperature will be checked by our care specialist. As we prepare your suite, you will be seated at our lobby while observing social distancing with other patients. You may get your snacks at our refreshments area, one patient at a time. Disposable cups for hot beverages have replaced reusable cups for the time being. Hand sanitizers and rubbing alcohol are also placed in key areas of the clinic for your easy access. Our doctors, care specialists, and staff are all wearing DOH-compliant personal protective equipment to ensure providing you with premier patient experiences. Your consultation is done in the privacy of a clean and spacious consultation suite. We also ensure to follow new normal processes for your physical therapy sessions and diagnostic procedures. Aside from our dentist and full personal protective equipment, we also use aerosol suction machines and acrylic covers during your dental procedures. If your doctor prescribed medicines, you may veer away from crowded drugstores as we have our pharmacy in the clinic for your convenience. We want you to be safe while in our clinic, even as we stay safe ourselves. All CMI staff undergo regular COVID-19 surveillance using Roche antibody screening. Lastly, CMI was conceptualized and built with your utmost safety in mind. CMI is on negative pressure airflow, and our high-efficiency particulate-absorbing HEPA filters are built in. Since day one, we have been using UVC lamps to sanitize the clinic in between patients and after clinic hours. Also, our housekeeping staff regularly cleans and disinfects the consult rooms after each patient's use. In CMI, we are committed to provide the premier care you require and the safety you expect. Visit us at CMI for your outpatient medical needs.
Good afternoon, everyone, and we hope you are well. Centre Medical International, or CMI, is a premier outpatient clinic located in the heart of BGC. With over 150 specialists and subspecialists on our roster, CMI continues to be here for your medical needs, such as specialist consultations by phone, video, or in person, diagnostic procedures, and preventive treatments such as vaccinations and checkups. No crowds, no queues, no hassle. CMI is the safe clinic for you and all those who are dear to you.
CMI is open Mondays to Saturdays, 8 a.m. to 4 p.m. Visit our website www.cmi.care or visit our Facebook page facebook.com/cmi.care for the latest updates.
Good afternoon. I'm Dr. Kristina Rubio, and I'm the Medical Director of CMI. Thank you for joining us for today's webinar on successful breastfeeding in the new normal, ensuring safe lactation for mothers and newborns with our speakers, Dr. Lei Camiling-Alfonso and Dr. Joanne Datangel-Gallardo. The COVID-19 pandemic has brought about many changes in clinical practice, including delivery and postnatal care. Some situations may make initiating breastfeeding challenging, such as shortened length of stay in the hospital after delivery or decreased lactation support in hospitals. Once at home, mothers are even more isolated than ever, and many need support and guidance to be able to continue their breastfeeding journey. CMI wants to make sure that we provide medical support in any way we can, supporting each other as we continue with our mission of providing premier patient experiences. In today's webinar, our speakers will share with us their expertise in successful breastfeeding. Before we proceed, just a few reminders. We have muted everyone's microphones and turned off your videos for the duration of this webinar. For any questions, please type them in the chat box, which can be found at the right side of your screen. We will group similar questions and have our speakers cover as much ground as we can. If you have not already done so, it will be great if you can include your full name to help us identify you properly for your questions and for other matters where we might need to reach you. And now it is my pleasure to introduce our speakers, Drs. Lei Camiling-Alfonso and Joanne Datangel-Gallardo. Dr. Lei Camiling-Alfonso is a lactation clinician at the Nurtury Breastfeeding Center and a member of the Academy of Breastfeeding Medicine. She was involved in the first Embrace, Unang Yakap scale-up through the Kalusugan ng Mag-ina, Inc., along with leading experts in the country. She holds degrees and masters in public health, a doctorate is a doctor of medicine from the UP College of Medicine, and a graduate of BS Molecular Biology and Biotechnology from University of the Philippines, Diliman. She is a maternal and child health technical specialist for the COVID response through the Philippine Society of Public Health Physicians. Dr. Joanne Datangel-Gallardo graduated cum laude with a degree in biology from the University of the Philippines, Manila. She is a board-certified pediatrician, a former chief pediatric resident at the National Children's Hospital, and is a member of the Academy of Breastfeeding Medicine. She has been a resource speaker for various workshops such as lactation management training at the University of the Philippines Philippine General Hospital in 2019, International Lactation Consultant Association in 2018, and International Breastfeeding Conference at the United States of America in 2018. Our speakers, Drs. Lei Camiling-Alfonso and Dr. Joanne Datangel-Gallardo, are expert lactation clinicians. They are excited to make face-to-face lactation support available through CMI. Friends, ladies and gentlemen, let us welcome our first speaker, Dr. Lei Camiling-Alfonso.
Thank you, Dr. Rubio, for that introduction. I'm going to share my screen now. We're very excited to actually hold face-to-face here in CMI. And thank you very much for having us this afternoon. And hope everyone at home is well. We are looking forward to a fruitful discussion with you this afternoon. So again, I'm Lei. And we will be discussing this afternoon, breastfeeding in times of COVID. And what we will not discuss would be vaccine brands, COVID-19 treatments, and COVID-19 management. We want to focus on the breastfeeding related concerns and the happenings that surround or affect breastfeeding success. But before that, I want to establish this that the fake feeling of safety can happen if we're not really careful about transmission. They can distract us from measures that are actually effective in spreading the virus. I believe that as new parents or as expectant parents, we are very careful in assessing the evidence, and maybe let's just end this with this, so everyone will have that assessment of safety and what is evidence based. So just to start with it, we have seen that COVID response has been a tough balancing act, both for patients and for healthcare providers. From our end, we have to ensure our personal safety and well-being, at the same time continue to provide quality care for everyone. No? And for women about to give birth and their newborns, it's quite unique because pregnant women, are not sick in that sense. And it is where there is an intersection of COVID and non-COVID care. Um, when initially everyone was thinking, okay, we have to disinfect everything. And now, because of data, because of evidence, and that's what I'm going to present now, the evidence that we know now, it has evolved really quickly. We're knowing more about the virus, and because of this, we can have more informed choices and actions. So, for example, in terms of exposure and transmission, we have been really scrubbing everything, disinfecting everything, and that's great. That's okay. That's universal precaution. However, more and more, we are starting to see that the virus spreads primarily through the air, and this will now entail more stringent measures in terms of ventilation. And for us, I'm a member of HPAC Healthcare Professionals Alliance Against COVID, and we are promoting Apat Dapat. And if you are pregnant at home, if you just gave birth, this is something that the whole family should be able to adhere with, and really be careful about. When we say Apat Dapat, it's about airflow, air circulation, air ventilation, physical distancing of 1 meter and more, always using face mask and face shield, especially when you go out and in crowded places. And the time of interaction with other people, you're not sure if they have or they don't have the virus, is less than 30 minutes or less. In fact, what we're saying is apat dapat and tatlo sapat. If you cannot comply with the four, make sure at least when you have the three, that is in a way you're safer by doing that. So I think this is the first step, knowing the minimum public health standards if you're pregnant or about to give birth, so that you are more confident that you're not going to get COVID. When we talk about pregnancy, there is quite rare. COVID-19 may be passed to a fetus. The virus can be passed on to a fetus, but this is quite rare, no? And this is not the main transmission for the baby. I believe that many of us here wonder, like, am I going to pass it on to the baby, or is my baby going to get it? The good news here also is that more and more, there are evidence that babies, young children, even young children, babies are resilient to coronavirus. And this has been seen in different patterns across data. But why? And this remains something that is being investigated. And one of the possible reasons is that babies, they do not have the receptors that's needed to actually get the virus inside the cells. But older people do. That's the ACE receptor. And also the infant's immune system might actually not be that mature enough to mount a severe attack. And most of the complications of the virus are actually because of that severe reaction, immune response to the virus. And in a way, the babies are spared because their immune system is immature. So when we talk about transmission also through the breast milk, maybe some of you may be wondering, from what I've seen across data, this is something that many people are wondering, but it's quite difficult to how do you measure that? And what this study says is that, wait, I'm sorry. Yeah. So what this data says is that the virus, they're able to actually get the virus, but it does not represent replication competent virus. It means that even if they get it, it's not something that is quite contagious, and it's likely not the source of infection for the infant. Right. How about the effects of vaccination? Many are wondering, should I get vaccinated if I'm pregnant, if I'm about to give birth? And what is the safety for my baby, for me? Actually, data is limited on COVID-19 vaccines during pregnancy, but based on how the vaccines are made and the science behind the vaccines, experts believe that they should be safe in pregnancy. And in fact, when you look at they have a registry ongoing, and as of today, as of April 11, around 4,000 pregnancies are being tracked in this pregnancy in this registry, and up to now there are no red flags yet. So in general, the safety of vaccines is commonly acknowledged among medical professionals and experts. So what else is new? This is something that just came out, and what they've seen is when you get vaccinated and you're pregnant, and you get you get higher antibody titers than actually being infected during pregnancy. So the vaccine can result in higher antibody titers. Antibodies are the ones that protect us against infection, and the vaccine generated antibodies actually cross the umbilical cord, and they are actually found in breast milk. So in fact, this is the largest cohort so far, and what they have seen is that vaccination of pregnant and lactating women can actually protect both the mother and probably even the newborn. So this is quite promising. So what is the bottom line? There's no need to stop breastfeeding if you want to get the vaccine. And when you get vaccinated, antibodies can be passed on through your breast milk and help protect your child from the virus. So maybe we've taken out the vaccination concerns and the transmission concerns. I hope that's clear. But how about giving birth? Many of you might be just about to give birth, and what has changed in the new normal? So perhaps it's good to also discuss what was there before the pandemic happened, and even before that period when the mother gives birth to the baby is unique because you have two patients, and it requires a lot of coordination among the healthcare providers, both the obstetricians, pediatricians, and anesthesiologists, no? And for those and of course the mothers and their families, right? And we have in our country the first embrace as a policy, wherein you have four simple evidence-based and cost-effective steps that cover births for sick preterm or even those that are born through cesarean section. And for those who have not seen it yet, this is what Unang Yakap is. It's about immediate and thorough drying of the baby, early skin to skin contact, and properly timing of the cord so that the baby gets more blood, or the blood that if clamped prematurely would be lost, and then non-separation of the newborn from the mother. You might see here what happens to this policy and what happens to this standard when the pandemic came. So, but what are the evidence for this? So here, what is the impact of breastfeeding if it is delayed? Here you see the number of hours after birth, within an hour, and then day 1, day 2, day 3, and you have the risk of infection. What we've seen across the studies, and here it's 10,000 breastfed babies. These have been breastfed babies. The risk of getting infection goes higher, even if you just go like beyond an hour. And this is why the recommendation is immediate breastfeeding, skin-to-skin contact, non-separation, because you do not want to delay breastfeeding. Not because of the protective component of breastfeeding. And delaying also initiation increases risk of infection-related death. Here in Nepal, it's 22,000 breastfed babies. This was pre-pandemic, and you will never find another study like this because you don't want to withhold breastfeeding from babies if you know that it's going to be beneficial, right? So here, just looking at here, if it's beyond an hour, it's already doubling the risk. So well, another one, I think this one means that if you just let the baby and the mother be, without doing anything, just on skin to skin contact, increasing the length of time they're on skin to skin contact actually increases success. You haven't done anything yet, but increases success. So what we see here is that interventions during giving birth are time sensitive. And we know that initially back then, people still don't know how the virus works and how it's transmitted. And therefore, it was a knee-jerk reaction to separate the mother from the baby. We don't know how the baby will be affected. But because of what we continuously know and what evidence is currently coming out, then we know better. So yeah, there's no evidence to support that early separation improves outcomes because separation may not prevent infection. If you want to prevent the infection from the mother, then if the baby is separated, you're not sure if the baby will be getting it from another source, right? And it creates greater concern regarding the long-term benefits and the well-being of both the mother and child. Another thing, if you separate the mother and the baby, that will be twice the burden because it means you need to have two separate sets of caregivers, equipment, and of course you need to separate the baby. And how do you care for the baby at home? And then if you separate, then you lose that chance for skin to skin contact, and there's disruption of initiation of breastfeeding, and of course there's extreme stress. So what are we saying about this? The WHO and the UNICEF and different the experts that have seen the data, they still recommend that we should enable mothers to remain together and practice skin to skin contact, and rooming in and baby-led breastfeeding. So this has been the general consensus since last year, and this has not changed. It has stood the test of evidence and time, even a year afterwards. And in fact, this was uh, way back when the pandemic was started, and there were recommendations like this. And what we're saying now is that when we look at what doctors and what healthcare providers should do, we have what's called clinical practice guidelines, and clinical practice guidelines are taking into account how can we make sure that the patient gets the best quality of care. And when we say that, we review all the evidence. Today, like I've given you some of the evidence and I've shared it with you in a very easy to understand way. But the people who are reviewing this evidence, they're gonna have to go through so many papers, and you don't need to do that. They will do that and then assess the benefits and harms of alternative care options, and reduce inappropriate variation in what to do and what not to do so that the patients receive optimized care. So what is the relation of this clinical practice guidelines in keeping baby and mother safe and breastfeeding also um, successful? So when the pandemic was starting, as mentioned, there was a lot of variability in what was being done. But after all the evidence has been reviewed and meetings and different negotiations happened, and here there is a policy now, the interim guidelines on COVID management of pregnant women about to give birth and their newborns. And it has applied all the evidence that we discussed earlier. And part of that is non-separation and giving the mother, the family, that control also in shared decision making, and being able to undergo the unang yakap after the benefits and the risks have been discussed. So bottom line is our policy right now, even during the pandemic, is by default still the first embrace because of its benefits, and the benefits outweighs the harm. And here we want to emphasize that based also on the evidence, breast milk is essential. It gives powerful antibodies that fight off the illness and build immunity. So many people think breastfeeding is just about food. It's not just about nutrition because especially during this difficult time, we have seen that even the breast milk can pass on the antibodies to the newborn. And this is something that needs to be taken into account when we decide to breastfeed or not. and then it helps in digestion, and of course the composition changes and adapts as the baby grows, because breast milk is like a living liquid. It really conforms according to the needs of the babies, of the newborn. So I think when we do the lactation support, we take into account all of these evidences, but at the same time we always ask, what is the feeding goal of the mother, and we support as much as possible according to this. What is the goal of the mother, and then what is the evidence saying, and then we discuss the harms, the benefits, and at the end of the day, there's that patient centeredness or family centeredness in the decision making. We don't push agenda that might not be fit to the context of the mother or the family. And what we desire also, as we provide lactation support, is that there's collaboration between other healthcare providers. So I think I will end with this video. I hope it works. It's just a 1 minute video of summarizing like the recommendations, the practical recommendations of WHO. And this is something that we have also adopted as a country. Enjoy the video. So thank you very much, and see you in the Q&A. Over to you, Dr. Rubio. Thank you.
Thank you very much, Dr. Camiling-Alfonso, for your talk. So we will have the Q&A later in a few minutes, but not before we listen to our next speaker, Dr. Joanne Datangel-Gallardo.
Good afternoon, everyone, and Dr. Rubio, thank you for introducing me. Okay, I would get to my slide. Okay, I'll be talking about what are the common concerns of the mothers. Even before the pandemic came, there are many concerns, and I would also talk about when to call for help. Many soon to be mothers, or even those who have just given birth, have a lot of questions about breastfeeding, sustaining their milk supply, what food they need to eat, or what not, only to find out millions of information on the web. Being part of a mother's group in social media accounts may also help. Finding tutorials in YouTube may also help. But some information can be contradicting or may not help at all. Since even the World Health Organization agree that breastfeeding is a basic need of a child, it is important that you know health professionals that can help answer your questions. Timely assistance can save you pains and heartaches from early weaning. Let me present to you some of the issues mothers go through during their breastfeeding journey and clues of when to seek help. Next slide. Worldwide, only 4 out of 10 mothers continue to breastfeed exclusively up to 6 months of age. The Philippines scorecard is slightly lower at 34%, or 3 out of 10. And one of the most common reason for early cessation of breastfeeding will be seen in the next slide. My baby is not getting enough. Studies say that approximately 35% of breastfeeding mothers think that they had insufficient milk supply at least once in their breastfeeding journey. Whether their insufficient milk supply is just perceived or in fact a reality sometimes needs proper assessment by a health professional. Actual insufficient milk supply is very rare. In fact, international studies say it only comprises 5% of those mothers who believe they have insufficient milk supply. Most of these conditions are also recognizable and managed by breastfeeding clinicians. Next slide. Many of the patients who come to me have asked me if they have insufficient glandular tissue. Although this condition exists, it is extremely rare among Filipinos and can be easily ruled out by proper physical examination. Usually, their breasts never develop much during puberty, have at least 4 centimeters flat gap between breasts, or one or both areola may look bulbous, as you can see in the picture, no? Or there's just lack of breast development despite being pregnant or giving birth. So basically, if the moms tell me that they have indeed felt breast changes during their pregnancy, they feel some engorgement, I think the diagnosis of IGT is highly unlikely. Despite this, many mothers with IGT, in fact, have been able to continue breastfeeding with proper support, albeit some needed supplementation. Next slide, please. Mothers who underwent breast augmentation usually have no problems with breastfeeding, especially since breast implants are usually now inserted under the chest muscles, which does not interfere with the lactiferous ducts and sinuses. Those with mild risk of developing inadequate milk supply are those who underwent breast reduction or maybe an excision of the lump, wherein some of the milk producing ducts and sinuses may have been severed. However, most can continue to breastfeed in the unaffected breast. There are 3 stages. Can you look at the number 3? There are 3 stages of milk production. The first stage of milk production happens at the third trimester, lactogenesis 1, in preparation for the birth of the baby, so that when baby comes out prematurely, the breasts are prepared to produce the first milk called colostrum. It is thick, it is yellowish, so it's scanty. So we really don't expect the moms to produce a very copious milk right after their birth. Okay, so mothers who have obesity or diabetes may have delayed lactogenesis 1, but their condition is easily recognizable and manageable, that the condition can be easily reversed. Lactogenesis 2 happens 48 to 72 hours after giving birth, wherein colostrum transitions to become copious, whitish, transitional to mature milk. Disruption of this stage is usually mechanical, such as delayed initiation of breastfeeding or separation of the mother and the baby. That's why, with Dr. Lei's discussion a while ago, we encourage mothers to insist the hospitals, the health professionals, that their baby should receive the first embrace or the unang yakap, be roomed in immediately, and breastfeeding initiation started early, so this delay in lactogenesis will not happen. Experienced clinicians can still support mothers who experience delayed lactogenesis and reverse the condition. Actual insufficient milk supply is indeed rare, which leaves the remainder of the moms to actually have just perceived insufficient milk supply. Next slide, please. Some complaints of moms who think their milk supply is lacking are listed on this slide. Baby feeds too frequently or less frequently than before. Can be age dependent as their digestive system matures and your milk supply stabilizes. Therefore, supply may not be a real issue. Babies cry for so many reasons and not only of hunger. Okay, example are wet diapers, noisy environment. It's too hot, it's too cold, too bright, too dark, too many stimuli. We usually ask the mothers to sort them out first and breastfeed in a conducive environment where baby can breastfeed peacefully. It's really not usually the matter of supply when baby cries all the time. Baby seems leaner than other babies her age. Well, we can attribute some to genetics actually. If mom and dad were also leaner during childhood and infancy, as long as baby seems to be growing on their own curve and hitting their developmental milestones, mothers may not need to be too worried. Pumping so and so ounces of milk is not really a reliable sign of milk adequacy. Unless moms are exclusively pumping or far away from the baby, it should not be much of an issue. Babies are the best extractors of mom's milk when the latch is effective. A study of mine supports it. In my study, we tried to relactate moms who have had almost zero milk supply to full or partial relactation. Babies were able to get well and were able to gain weight and completely or partially go back to the breast, despite just being able to hand express. Would you believe an average of only 30 ml or 1 ounce in 15 minutes at any given time during the intervention? And yet, the results were wonderful. Next slide, please. So, what are the signs that you need to call for help? Well, for the baby, at day 6 of life, baby needs to be urinating at least 6 times in a day, and the quality or the color of the urine is light colored, can somehow soak his or her diaper moderately. If this is not the case in newborns, then you need to seek professional help so that it can be investigated. It doesn't instantly mean that there's dehydration, but maybe you can just ask for professional help if those are the conditions. How about the dark greenish stool at day 5 or more? Well, breast milk cleanses the colon at birth. So after a few days, meconium, the greenish stool, should be already eliminated. Okay. And the stool color by day 5 should change and become soft, yellowish, seedy. In Tagalog, I always ask them if their stool becomes more like binating itlog na may seeds, buto ng kamatis. What's binating itlog in English? Anyway, so that's how it should look like. Okay, so if the stool remains meconium-like, baby may not be getting enough milk and you may need to seek professional help. Babies seem to be so hungry or uninterested to feed all the time. Well, babies do not pretend. If they are hungry, they will seek the breast. If the baby never seems to be satisfied or the the word there is never or all the time or never looks interested to feed and doesn't seem to put on some weight, you can call your health professionals. You can call us. For the mothers, if you feel tired every single day, all of the time, and it doesn't get better down the road, you are experiencing severe anxiety, breastfeeding does not feel right, or you cannot even put your baby down and you feel helpless, maybe your health professionals or we can help figure things out for you. Next slide. My baby does not want me. Another issue. There are some mothers who think that their baby does not want them when the baby swings their head from left to right as if saying no. It really doesn't mean that, no, I don't want your milk. Okay? Babies are not yet, their eyes are not yet crystal clear, but they have one target, the dark circular areola of mom's breasts, and so they're eyeing on them and they want to latch on them. So sometimes they are opening their mouths to what seems to be a moving target, so it may seem like they're shaking their head, but they live for the breast, so it might really not be because of your milk supply. The baby cries all the time. I have discussed the reasons why the baby might cry, and usually they cry because they cannot sort themselves out. Other reasons may be valid, such as the baby throws a fit whenever they are near the breast or cries when held a certain way. My usual questions would be, was there a sudden change in mom's perfume or soap or smell? Is mom stressed out? Well, babies can feel that, and baby can be also fussy when those changes happen. Or even a change in the environment can cause sudden fussiness. One of the serious causes of refusal to breastfeed is sudden introduction of bottle feeding. Because there in this time, maybe nipple confusion can set in, and they might prefer the softer feel of a nipple. Next slide, please. So when do you have to call for help? Let us help sort things out for you when baby have started feeding another way and seems to absolutely despise the breast. We have no magic, but if we spend a number of hours or days, we might be able to help baby latch to you again. Being perennially sleepy all the time, doesn't matter what time it is, baby looks so sleepy at the breast. It is also a sign that maybe the latch is ineffective. So call us when this happens. We may also be able to help if mommy desires to bring baby back to the breast, but well, tough love and determination is a requirement for this. When mom just feels guilt or aversion towards breastfeeding, anxiety, or frustration, we may be able to help just sort things out for you, but because maintaining sanity is most important for the mother. Next slide, please. I'm super tired. I do not have an opportunity to sleep. What day is it again? I feel helpless. I cry with my baby. My baby never lets go of my breast. I just want to stop this, but I know my baby needs me. Next slide. You can call for help when you experience these symptoms, as these are signs that breastfeeding may not be going well. You don't need to suck it up and drive on. You might need to have professional help. So when baby breastfeeds too long, never seems full, always irritable or too sleepy, when baby is irritable a few hours a day and then gets to be a happy baby again, it seems normal. But when the baby seems irritable and too sleepy all the time, then there must be an issue. Well, my baby doesn't seem to get heavier or bigger at all, can be a reason to seek help also. When mommy sleeps poorly due to baby's demand, there's anxiety or depression, tired of tired of preparing for breastfeeding. Be Breastfeeding should bring some comfort to the mom. It's because the love hormones are overflowing when we breastfeed. So when it has become too uncomfortable for the moms, then you might need to ask for help. Next slide, please. It's super painful. I feel pain on my uterus whenever I breastfeed. In the early days, it is natural to feel some tightening and pain of the hypogastric area because of the letdown hormone oxytocin, which is the same hormone that contracts the uterus. So this is normal, and it's even better because it stops the uterus from continuously bleeding. So it shouldn't be a problem. Is it still natural to be this painful? Okay, contrary to the belief of most moms, it is not normal for breastfeeding to be painful. While it may be normal to have a 2 out of 10 or 3 out of 10 pain in the first week of breastfeeding, um, you must be getting used to breastfeeding right after that, and the pain should go away. A pain of 6 out of 10 to 10 out of 10 is not normal and may indicate that the latch is shallow and the feeding may be ineffective. Positioning and attachment may need to be corrected. However, if positioning and attachment and skills have already been corrected by breastfeeding counselors, breastfeeding clinicians, then there's still this toe curling pain. I despise the next feed. There may be an anatomical problem in the mouth structures of the baby, like an oral tie, no, a tongue tie or high arch palate or clefts that needs to be investigated further and managed appropriately. An experienced clinician will not dismiss this, but investigate further. Same as toe curling pain, despising the next feed. How about other problems like my mom says I need to toughen my breast. You don't need to toughen your breast. You need to have a proper latch and attachment that just like Dr. Relay has already discussed earlier. And the breast should be naturally soft so that baby will not have a hard time latching onto the breast. Okay. My breasts are always sore and engorged. I feel lumps on my breast. I have inverted nipples. Engorged and sore breast lumps, feeling feverish, may be indications of breast infections and need to be investigated too. Most mothers with inverted nipples do not have to stop breastfeeding, as nipples are not needed in breastfeeding. It's the areola that the mouth needs to reach and the tongue needs to reach to extract milk through vacuum generation. If the latch is deep enough and the position correct, continuous breastfeeding is not disrupted and it may even avert the nipple out. So it doesn't matter if you have inverted nipple, you can still continue to breastfeed. But if it has become too difficult for you, you can use an inverted syringe, which we can also talk about later if you need that help. But you can suction a bit of the nipple a bit of the time to invert it. But usually it's not needed. Some of my patients did not ever need inverted syringe. Okay, next slide, please. Okay, so when do you need to call for help? When there's toe curling pain, there's high pain intensity, we need to we need to investigate that. Okay, if you come for breastfeeding skills assessment, is my positioning correct? Is my attachment, is my baby's attachment and latching to me correct? You might need help because breastfeeding is actually skills dependent. Okay, but we can help you with that. Other doctors and even breastfeeding counselors can help you with that. If there are symptoms of breast infection like redness, swelling, flu-like symptoms, fever, okay, palpable breast mass needs to be investigated by imaging, and we can also, if needed, we can refer to professionals that we trust. And inverted nipples, if you're having a hard time breastfeeding with inverted nipples, you can also ask for help from us. Okay, next slide, please. I do not feel supported. My mother tells me my milk is no good. While breast milk, once it is produced, is 100% pure with enough nutrition that the baby needs. Except when moms are severely malnourished or anemic, breastfeeding by moms with a balanced diet is always good and enough for the baby. My husband wants me to stop breastfeeding. I am enjoying what I do, but I still need to do household chores and take care of my other kids, so I want to stop. My doctor tells me that I need to supplement. These are complaints that we may be able to mediate with your immediate family. Um, what Dr. Lei has discussed, that there will be clarifications of feeding goals, goal setting, and what can be done in your context. Okay, that you can come up. We may come up with compromise plans to support each other while breastfeeding your new bundle of joy. Next slide, please. So, seek professional consult when you need encouragement and support, maintaining milk supply, seeking support from other family members if you need us to mediate for you, clarifying feeding goals and working towards them according to your own context, figuring out best practices, tailor fit to your situation, and this is the most important. We need to preserve the mother's sanity. Next slide. In summary, these concerns are valid reasons to seek professional help, and you may consider CMI, us in CMI, to help you sort things out for a realistic and successful breastfeeding journey, such as the low milk supply, whether it is perceived or actual, and you just need to sort things out. Baby refuses the breast. There's persistent breastfeeding pain, symptoms of breast infections, breastfeeding skills support, adjusting and clarifying feeding goals according to your context. And, well, mothers may have anxiety or depression. We can help, and if needed, we can refer to other health professionals that we trust. That's all I can say, and thank you for listening and thank you for inviting us here.
Thank you, Dr. Gallardo, for that wonderful talk. So we'll now open the floor for some questions. And I think a little bit later before we end, we'll try to replay the video because there was no sound the first time we played it. Is Dr. Alfonso still here? Can you open your camera and your mic? Lei, so that we can discuss in case there are questions for you. And also, before we start, I want to say hello. We noticed among our attendees, we are honored by the presence of our professor, Dr. Ramian Silvestre. Hi, ma'am. Um, so, so thank you for joining us today. She is the expert on breastfeeding. So thank you, Dr. Ra. We're happy to have you. And EPM nyo na lang po kami for comments. So, Dr. Lee and Dr. Datangel, we have a couple of questions. So one of the questions, it was an early question from an anonymous attendee. So do moms who suffer from gestational diabetes, do they generally have lactation issues as well? So or are there other also comorbidities among mothers that among pregnant women that we need to watch out for? Maybe they might have issues later.
Okay, can
Dr.
I?
John, would you like to take a stab? Yeah.
Yes, thank you. Okay, generally, just like my lecture a while ago, it might cause a delay in lactogenesis or breast milk production, right before giving birth in lactogenesis one, but after that, if the mom seeks professional help with their internist and the blood sugar is controlled. Generally, my patients who've had gestational diabetes didn't have any problems breastfeeding at all.
Mm-hmm.
For as long as their sugar levels are normal. And also, I want to take this opportunity to also warn the moms because they're just taking too much lactation cookies,
Oh, okay.
all of those drinks that's super high in sugar. And I've had a patient who hasn't had any problem with the supply, and then she had a problem with the supply, and then when I investigated further, like every day she's taking all of these supplements and it increased her blood her blood sugar. So well,
Oh.
there it is. So when we try to remove that from the diet, it might help, but it's not that evidence based to use all of those supplements. Maintaining a healthy diet is already enough. Okay, what are other conditions that can that can I think one of that is thyroid conditions if
Mm-hmm.
these are not controlled, so it needs to be controlled. And
Mm-hmm.
others, but those who have polycystic ovarian syndrome, I've had patients who got because they had difficulty getting pregnant, but when they give birth, they have no problems breastfeeding at all. So the thing here is you need to get those hormones or those levels controlled and
Mm-hmm.
maybe need seek professional help, but it usually doesn't cause a drastic decrease in milk supply.
Mm-hmm. Okay.
Perhaps just to add,
Yeah. Go ahead.
Dr. Krista, maybe it's important to note that even if you have comorbids, it's very important that the initiation of breastfeeding is not delayed because
Mm-hmm.
this will prevent any further problems in the future. And as Dr. Joanne also mentioned kanina, no, yung anxiety, breastfeeding shouldn't really be painful. And if a mother is anxious, it means something can be optimized
Mm-hmm.
because when you learned it, because it's like a dance, you and your baby will learn how to dance together and do the choreography of breastfeeding, and you will be sleeping better because of that. And as mentioned, as one of the signs that something might be wrong is that you're losing too much sleep.
Mm-hmm.
You're not able to rest well. We cannot say that breastfeeding is easy for moms who need proper support with latching and positioning. So there you go.
Okay, so we have a lot of questions. But before we change the topic, Dr. Joanne, you mentioned lactation cookies. So while we're at the topic, I want to know your take on these mga malunggay pills. Or I remember even when I was trying to breastfeed, ang dami nag-aalok sa akin ng mga malunggay, domperidone, all these things that they're telling us to drink to increase your milk supply. Do you have a comment about that?
Okay, this is really controversial, but those supplements, the lactation drinks, the lactation cookies, is still actually they're putting in the supplement. They're putting in herbs that's supposed to help, that has very scanty, not too many evidence based.
Evidence. Mhm.
Yeah, it's not really evidence based that it can really indeed help. But sometimes some moms would swear on it, but
Mhm.
maybe because they're feeling, oh, I'm taking something so I
Mhm.
can rest now and I can be
Mhm.
more relaxed and I'm not
Uh,
anxious because I have this. So, but
uh,
yes, but there is medication, that the domperidone, if it only is given by health professionals, if there is indeed actual in the adequate milk supply, which needs
okay.
to be investigated first. But
Mhm.
that one has more,
More
relatively
evidence.
more evidence that it
Mhm.
can help.
Okay.
Maybe maybe our tip also for moms is fix the latch,
Mhm.
because a
True.
proper latch will allow effective milk transfer. So you have milk in your breast. What you need to do is to get that baby, your baby, transfer that milk to the mouth. And this is a mechanical process. And even if you drink any supplements there, that's not gonna fix the main problem, which is the mechanical latch. So there you go.
Yes, that's
Mm.
true.
Okay. So thank you for that. So we have a question on the first question in our chat box is, if I want to donate milk, are there new safety measures because of the pandemic? Do I need a swab to, to certify that I'm COVID free, I guess? So what are the safety measures for milk donations during the pandemic?
Right, I can take a stab at that. So when we talk about milk sharing, what we advise really is if you're going to donate, go to the milk banks so that there will be prioritization in terms of milk that you will donate. You are making sure that it's being given to those who are really in need. And the milk banks really know how to handle very well breast milk donations, and they'll be giving you enough advice on how to go about it. But in terms of like breast milk donation, we know, as we discussed earlier, that if you've had COVID already, then you'll have antibodies, and even this is transferred to the breast milk. But of course, we do not really want to like say you're gonna promote like informal milk sharing all across the board. Like, of course, there's a level of trust that you need. You cannot sell breast milk anywhere. Just get breast milk if you need to, once you also address the latch, because getting breast milk donations will not fix the main problem. In fact, it
Mm-hmm.
can also aggravate the problem, because that will compromise the demand,
Mm-hmm.
and of course the supply will also later on follow. So
Mm-hmm.
please fix the problem, why you need to have donor breast milk, and then please don't get sources elsewhere, I mean from people you do not trust. And if you're
Mm-hmm.
going to donate, please donate to the milk bank so they can prioritize who really needs it. Thank
Okay.
you.
So the milk bank will let you know if you need to do testing, if you're one of the lucky ones na oversupply and want to donate to mga NICU. So thank you. Of course, they're always happy to receive milk. So related to that, I had a question earlier about, for example, if the mother, are there other additional things they need to think about when they're preparing, for example, breast milk for storage? Do we need to sterilize the things more, or are there any additional safety measures due to just because of COVID? Siguro, yes, Lee. Go ahead.
Sean, would you like to?
No.
Or
You can do it, doc.
okay, so short answer to that. There's no special way really to store. Say if you're going to use the breast milk, like within 8 hours, you can actually store it. It's going to be good, no. But if you refrigerate it, there are guidelines on how long it's gonna take for the breast milk not to be good for consumption. Secondly, breast milk has
Body.
antibacterial properties, and it can store well. So there's really no need for excessive gadgets or
Mhm. Yung mga UV.
any,
Mga
yeah, no, that's not really necessary, for
Mhm.
as long as what you do is you clean your implements, and then make sure it's really air dried before you add the breast milk if you need to store. My second question actually is that why would you even need to express if you just gave birth? There's
Mhm.
no need. Just
Yeah.
relax and focus on getting your
Exactly.
baby with you. Don't stress about it. So
Mhm.
don't store milk yet. when you
Mm,
give birth. And yeah, so we can discuss that at further lengths, but please don't
yeah.
yeah, don't fret about it.
Right. So there's a question if there are public sources for patients aside from one-on-one counseling for mothers, or I suppose meron. That's what nandito si Dr. Sylvester. So of course we'll say yes. Definitely, Doctor. Can you mention some of the available public health programs or resources available to mothers?
Can I put my mother? She's like I Dr. Ramian is there. Can I Dr. Ramian? Can I put you on the spot? But because we have a lot of programs going on, and the thing is, there are a lot of moms that are actually helping each other. Dr. Ramian, would you like to say something about this? Uri, if that's fine. But yeah,
I'm sorry, repeat the question.
So
Dr.
there's a question about, are there public resources or government lactation, because many of them are private practitioners, and definitely of course if you need one-on-one help and you have the ability to pay, definitely if you can see a private practitioner. But baka marami daw mga nanay na who cannot afford and are looking for more public or government resources or programs available to help support breastfeeding.
You're really putting me on the spot, no? So, just as a disclaimer, I am neither government nor in private practice, no. So, all I know is that I've been invited to speak at their lactation management training.
Mhm,
I think it's next week.
mhm,
So, the government is also trying to step up efforts to provide this so crucial breastfeeding support, counseling,
mhm,
and protection. In fact,
mhm,
through the health system, and that's one of our battle cries, diba, Doc Lei,
mhm,
Doc Joanne, and also because breastfeeding crises don't happen conveniently during office hours, and definitely not always with a quiet baby, that cooperates during the session. So, but in the what, maybe 2 decades that I've been trying to work at breastfeeding counseling, things have improved pero super kulang pa. That's
mhm,
all I can say, no? Dun sa question about donating milk, is there any specific
requirements.
preparation, no, special preparation? Um, And this, I even received the question sa messenger dito because the neonatologist was questioning the donors' practices, no, in expressing the milk, no. And so the special preparation um, really is not special, no. Pinaka-importante is that you don't you don't express, if you're hand expressing, which we prefer, is that you hand wash. If you have signs or symptoms of COVID, put the face mask, face shield on, hand wash, express into a clean container. If the donor milk is if your donor milk is going to a milk bank, then they are going to pull that milk and pasteurize it. So the pasteurization process, that is a standard process in all of the human milk banks here in the Philippines, may sinusundan talaga na temperature that is maintained
Mhm,
for specified duration of time, and it eradicates all viruses, no? All
mhm. Oh,
HIV,
okay.
HTLV, blah, 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 blah,
Mhm,
CMV,
mhm,
cytomegalovirus, no? So yung questioning a mother's practices in expressing the milk becomes
mhm.
immaterial
Yes.
when the donor milk goes to a human milk bank that
Mhm,
practices the proper procedures, no?
mhm,
And the quality control dictates that they also do microbiologic cultures by batches of the breast milk, no? Iba yung usapin kapag
mhm,
uh, internal milk sharing, and
mhm,
usually those are the guidances na nabanggit ni Dr. Lee, no? Dun sa pag clean ng container, pag
mhm,
refrigerate ng milk, etc., etc.
Okay, thank you, ma'am.
You're welcome. I don't.
Very nice
Thank you,
idea.
I won't
ma'am.
be
Thank
able
you.
to necessarily answer the question about availability of public
Yeah.
support, but I'll consider it a planted question so that we clamor for more
Yes,
support from the
of
Yes.
course.
from the government
Yes.
to support women who breastfeed,
Mm-hmm.
especially because that is a woman's work
Mm-hmm.
toward rearing, nurturing the future productive members of our society.
Yes. Okay.
Amen.
Amen. Yes, ma'am. But
Thank you,
until
And
ma'am.
I
then,
want to also add on that when I was practicing in National Children's Hospital, I'm one of those who trained about 600 to 1,000 employees. So I think this is also happening naman countrywide. It's
mm-hmm.
just that that there are already trainings for
Mm-mm.
breastfeeding management for our patients who go for help at government hospitals.
Government
It's just
hospitals.
that maybe hindi lang siya masyadong priority as of now. That's why there is a
Mm-mm.
clamor for this service. And that's one of our, sana in our lifetimes could happen.
Yes. And until then, of course, konti cool kasi I think the issue is super konti kayo, Lei and Joanne and Ma'am Yan also, who are specializing in this very important work. And we're very happy to have you here with us in CMI, available to our patients, to our pregnant patients, future mothers, and also breastfeeding mothers, and to making face to face coaching and assessment for breastfeeding issues available at our clinic. So thank you also. So if any of you are interested in one-on-one consultations, either in person or through Zoom, Dr. Ale and Dr. Joanne will be available through CMI. And then you can get in touch with our clinic for appointments. Siguro we have about 2 minutes left for a few more questions. So I have a few vaccine related questions to Dr. Ale. Are you ready? Because this is probably going to be for you. So there's a question about frontliner who got vaccinated, and then the day she fed her baby got fever and fussy, and she believes this is from vaccination. So what should we say to these mothers to ease their worries about vaccinations and breastfeeding?
Right. So the mother, it's important to explain to them perhaps how the vaccine works. So
Mm-hmm.
if the fever happened right after, then we know that it's not really related. The vaccine has even had its effect on your body, less
Mm-hmm.
the baby. So we need to be able to explain to the mothers how the vaccine works so
Mm-hmm.
that we can also rule out any relation that they claim, and we need to be equipped on that. I hope that's the most simplistic answer I could give.
Yes. And then, so there's a question on in the first, if my milk production is low in the first days of baby's life, can I mix feed or should I wait? Ayan, go ahead, Ma'am Joanne.
Yes, I want to clarify that. I think I already discussed this in passing in my lecture a while ago that breast milk production happens even before mommy gives birth. So the breast is already prepared in the third trimester, as early as third trimester. So there's already breast milk production, but that breast milk is not white. It's not copious, that means hindi siya madami, but it's just the what you call thick yellowish viscous colostrum that is about 5 ml at most in quantity. So really find it really absurd for the ones in the hospitals who say you don't have milk, you need to buy this brand and so forth and be ready with a bottle, because what's natural is that you will have that 5 ml at least, at most, colostrum for at least 1 to 3 days. But this is the most important breast milk that the baby could ever have. It's like the first vaccination that the baby could ever have, because it has the most amount of antibodies. and immunoglobulins that baby can receive. And
Mhm.
number two, okay, if unang yakap is done, you know, early during birth, and the breastfeeding initiation, because breastfeeding initiation and non-separation is already number four. It's the fourth step of unang yakap. So what it's gonna do is it's gonna prepare the body to produce more milk by latching on, So if that is done, that is safely guarded, those methods, the unang yakap, the first embrace, then the mothers and even the health professionals looking after the mother shouldn't be so scared about having low milk supply in the first few days of life. At the third day, that's when the breast milk will transition to white,
Mhm.
copious milk. Third day, fourth day. So I think you shouldn't be worried about that
Mhm.
early. So please no,
Yeah.
you don't need mixed feeding. Sorry, I need to expound on that. Mixed feeding, starting bottle feeding, will take the mother out. Will take the time with the mother and the baby,
Mhm.
okay, and it will even uh, it will even lessen the opportunity of the mom to produce more milk, so it might even set in a decrease in milk supply early on if you mix feed. So you need to breastfeed at least 10 to 12 times a day for newborns,
Okay.
but you don't need to count that. Just breastfeed by demand. Just breastfeed when the baby needs to breastfeed and seems
Mhm.
hungry. So there.
Dr. Krista, I just
Yes.
want to add to the points of Dr. Joanne. Perhaps it's important also to imagine the colostrum, the sticky uh, breast milk that's just kakatiting, no? It coats the gut of your baby. By coating the gut with protective like antibodies and other protective factors, it like forms a paint that protects your baby against viruses and other agents that will harm your baby. And the moment that you add, say, water or other milk in this, that coating actually is disrupted. And I think that's the most important way to imagine it. We discourage you really from mixed feeding, especially very early on, so that kind of coating, that kind of bacterial flora is preserved for the protection of the baby. Thank you.
Okay, so thank you very much, Lei. So I think in summary, Dr. Joanne and Dr. Lei emphasized the importance of early latching, unang yakap, that breastfeeding, you don't expect it. Like I see there's a question here, but I guess I can summarize by saying that no, it's okay if you don't have the what looks like breast milk if at in the first day, ganun talaga in the first couple of days, it's really just the colostrum. So you don't have to worry that you're not generating huge amounts of breast milk until later because that's normal and expected. That's correct, Doctora. And then also there are some questions about vaccines. We said we won't be discussing vaccines here. However, the general consensus is yes, get vaccinated if it's offered to you in discussion with your obstetrician, and no specific brand is known to be better than another one. We're still collecting data. Tama ba, Lei, right? That's the consensus. And generally, do not, yes, the advocacy is not to separate mothers and children, even now during the pandemic, because it's very important to support early breastfeeding, continuous breastfeeding for the safety of both the mother and the child. So, I think that's all that we have time for today. And it was a very lively conversation, and we're very happy to have our experts here with us. So this ends our session. Thank you so much, Dr. Lei and Dr. Joanne, and everyone else for attending our webinar. If you want to reach our speakers, we'll be flashing CMI's contact details so that you can send them your questions or book appointments if you have any, if you need one-on-one counseling or coaching. And CMI is open Mondays to Saturdays, 8 a.m. to 4 p.m. And you can visit our website at www.cmi.care or our Facebook page, facebook.com/cmi.care for the latest updates. So that's all we have time for today. Thank you so much, everyone, and goodbye. Stay safe. Have a good evening.